Hello guys, welcome back to another Med in a Minute. I am the Marm here with a brand new video this week. Now today we're going to talk about fibroids. I know it's very common. It's one of the most common pathologies in women and it's called leiomyoma. That's the right name. Leio means smooth muscle, myoma means a benign tumor. So it's a benign tumor of the smooth muscles of the uterus. All right, so when I hear tumor, I know you're thinking cancer, but it's actually non-cancerous. Now, there are different types of fibroids. You have the intramural, you can look on the picture. It's the most common type, and it's where the fibroids grow inside of the walls of the uterus. Then you have your subserosal, where it's grown outside of the uterus, and these can cause a lot of problems. They can get very big and it can obstruct organs that are nearby. Now the next one is your submucosal, and this one causes the most problem and it can have serious complication, is where the fibroids are underneath the lining of the uterus. And then you have the peduncular type, where as you can see they're on stalk and it can be inside or outside of the uterus. Now what are the causes of fibroid? Well, research is still being undertaken. The cause is actually unknown at this point. However, things like obesity has been linked to development of fibroids. Black women are more prone to getting fibroids, and at an earlier age, usually the peak age is about 30 to 40 years old. And also there is some link between fibroids and your estrogen level, and that's why you get it in pre-menopausal state as opposed to menopausal state. So now we're going to look on the signs and symptoms to look for to tell if you have fibroids. So painful intercourse, I know sometimes pain in intercourse may occur and it's not fibroids. However, you can know when it's abnormal pain. There is lower back pain, miscarriage, frequent miscarriage, you have leg pain, you have non-menstrual pelvic pain, so you have pain in your hip region and it's not because you're seeing your menses. Constipation because of the blockage of intestine, etc. from fibroids. Infertility, right? So you're trying to get pregnant, you can't. It may be fibroids blocking the fallopian tube, as well as preventing implantation in your uterus. You can have abdominal swelling, so your belly start to get bigger, you notice it. And there can be abnormal urinary patterns because, as we said, fibroids can affect surrounding urinary structure, and you have prolonged bleeding that is not a part of your men. So how to diagnose this? Usually it's an incidental finding, so you don't know that you have fibroids. It may be small, but when you go to the doctor, they actually run some check or you do a checkup and they find that you have fibroids. You may be pregnant and you go for a checkup as well and you find out that you have fibroids but asymptomatic. Now there are different sizes of fibroids. They can be really small and they can be very large. All right, and this will affect the symptoms that you get. Now for treatment, you're basically treating the symptoms. So you're treating the pain with your NSAIDs or acetaminophen, ibuprofen, etc. Also remember that we said that it was linked to estrogen level. So taking oral contraceptive can help with leveling or normalizing your estrogen and your progesterone level. If in case the fibroid is causing a lot of problems or it's growing and getting bigger, you may or they may opt for surgical removal of your fibroids, but this is based on your doctor's recommendations. So also exercise and dieting, you know, the usual, because as we said, it's linked to obesity and it is more prone in obese women. So ensure that you're taking care of yourself and go to your doctor if you have any of these symptoms. That's it for this video. See you in the next one.